Normal lungs function in order to transfer oxygen from the air taken in and bring it to the blood. From the blood, carbon dioxide is released and eventually exhaled out of the lungs. Cystic fibrosis is dangerous due to its ability to cause mucus to build up and line the tubes, allowing air passage. Healthy lungs consist with these tubes being clear for one's ability to properly breathe. The lungs are unable to carry out breathing when cilia are unable to sweep particles out of the lungs as a result of the thick mucus. This is one of the many examples for how bacteria becomes trapped and causes infection as well as permanent lung damage. The exchange between oxygen and carbon dioxide occurs in the alveoli. The alveoli absorb oxygen from the air and pass it into the blood, circulating it through the body in normal lungs. The normal function of the alveoli is to exchange oxygen and carbon dioxide molecules to and from the bloodstream, and the normal function of the ciliated tubes is to move back and forth to help move particles out of our body. Patients with cystic fibrosis, cilia are unable to move due to the mucus buildup, and this causes bacteria to form. A person with cystic fibrosis may look healthy on the outside, but on the inside, there are many things going wrong. A patient's lungs with cystic fibrosis has a thick coating of mucus that lines the lungs and the airways tubes. This makes breathing difficult because mucus can get stuck in the respiratory airways, including the primary, secondary, and tertiary bronchi. Also, because of the thick mucus, the cilia are unable to sweep the germs and other particles up and out of the lungs. The trapped bacteria and germs can cause serious infections and permanent lung damage. Other than the lungs, the sweat glands, respiratory system, digestive system, and reproductive system are all affected by cystic fibrosis. Within the pancreas and the liver, the ducts that transport needed materials and hormones often get blocked, and people with cystic fibrosis tend to be skinnier because they cannot fully absorb necessary nutrients within the small intestine. Currently, there is no cure for cystic fibrosis, but there are ways to help control the symptoms and reduce complications. A range of treatments are recommended for patients with cystic fibrosis, as well as regular appointments to monitor their symptoms. Patients with CF often take regular antibiotics such as Dornase alpha in order to prevent chest infections and to reduce the sticky mucus in the lungs. Bronchodilators are used by patients with cystic fibrosis in order to widen the airways and help make breathing easier. Bronchodilators are like an inhaler and they work by obviously dilating the bronchi. A disadvantage of using a bronchodilator is that it can have some side effects such as an upset stomach, trouble sleeping, increased heart rate, or muscle aches and cramps. But it is very beneficial in opening the airways. Another way patients with CF deal with their breathing complication is by having various kinds of breathing techniques. ACBT, active cycle of breathing techniques is what it is called, is a technique that involves a sequence of relaxed breathing, followed by deep breathing exercises and then huffing. This technique is used to help clear mucus from the lungs. To make these breathing techniques even easier, there are airway clearance devices that use vibrations and air pressure to help remove mucus from the airways. The only downfall is that these devices are very expensive and they can be very uncomfortable. If you ever see a patient with cystic fibrosis hanging off their bed with their head hanging down, they are using the technique modified posture drainage, which involves changing your position to make it easier to remove mucus from your lungs. Overall, although there is no definite cure, there are several medications and techniques that are used to reduce complications. That is all I have for you. Thank you for listening to my presentation.